In this video, I'm going to be talking about knee hyperextension, what it is and what you can do about it. The first video is going to focus primarily upon what hyperextension is, and the second video of this series will show you some specific exercises that you can do, particularly for the knee, in order to strengthen it effectively and safely. Is hyperextension something that we're born with? Yes. Dancers are kind of predetermined to a large extent. Most dancers are found to have hyperflexible joints. That means we're already kind of loosey-goosey people, so we can get higher extensions because our ligaments are more lax, and that kind of predisposes us to being good candidates to be dancers, especially in the ballet world. This is an example, okay, so I'm gonna use my elbow as an example of what straight looks like. That is elbow extension at 0 degrees. That is perfectly fine. That is within normal ranges of motion as a physical therapist. If I were to measure this joint with what my real range is, this is me straightening out my elbow all the way. That is elbow hyperextension. I'm going beyond 0 degrees. That's 0 or neutral. That is beyond neutral. I would say eyeballing it, that's probably about 4 or 5 degrees of elbow extension. Was this something I did because I did gymnastics or anything like that? No, I was born with hyperflexible elbow extension. That hyperflexibility that you see at my elbow is somewhat present in all my other joints. And I was a professional ballet dancer, and so that gave me some advantages as far as extension goes. With the knee, a lot of ballet dancers in particular look for a little bit of knee hyperextension to add to their line. If you are not born with an amount of hyperextension, should you work to get that? Absolutely not. Joints that are hyperflexible are prone to injury. The more hyperflexibility you have, the more prone you will be to injuring that joint. So in this first video, I'm going to show you some slides of what hyperextension is, what's considered within normal range. Okay, so a little bit of hyperextension is okay. A lot of hyperextension is dangerous to the joint. Dangerous is anything above 5 degrees in the hyperextended range of motion. And I'll go over how we measure that as physical therapists. In groups and dance ensembles, such as, I'm going to use the Cirque du Soleil as an example because I've been to a lot of medical professional conferences where people working, medical professionals who work with the Cirque du Soleil have spoken. Those participants in the Cirque du Soleil have to get into extreme ranges of motion. Many of them are super hyperflexible. They get into weird contortionist-like positions. The injury levels in that particular group are off the charts. And those injuries just don't go away when they quit the show. Injuries linger. They haunt people. As we age, they haunt at a greater degree. So that joint instability is not something you want to mess with purposely. If your knee is absolutely straight, awesome. If it's not absolutely straight and your knee is kind of bent and you can't get it all the straight, that's a different problem. Yes, you need to work on getting your knee all the way straight, but just to 0 degrees, not beyond. And again, I'll go over a range of motion measurements. I'm going to touch really quickly on knee hyperextension is indicative of quadricep weakness. In the second video, I'll go over where the quadricep muscle is and the specific exercises that will help you train to have more stable joints. And if you are hyperflexible, to help your joints get back to a better, more fully extended position without going into the dangerous ranges of motion. So let's take a look at a few different slides. Physical therapists use a goniometer to measure joint range of motion. There are different sized goniometers for different parts of the body. This one would be used for the knee. The center of the round part would be aligned with the joint, and the arms below hinge so that they are in alignment with bony landmarks to measure above and below the center of the joint. Typically, when therapists get really good at taking goniometric measurements, they can eyeball it. This is an example of a goniometer measurement for knee flexion or knee bending. The arms are in alignment with bony landmarks, the center dial in alignment with the center joint, and this shows about 150 degrees of knee flexion. This diagram shows a medial view of the left leg. The red line is a vertical plumb line, and on the right you can see normal alignment of the knee. That is a knee in 0 degrees extension. The red dotted line bisects perfectly through the middle of the joint. On the left you see knee hyperextension. The knee joint is posterior to that red dotted line. This is where the quadriceps muscle is located. It starts way up at the anterior pelvis at the anterior superior iliac spine, travels through the front of the thigh, goes over the kneecap, your patella, and inserts onto the tibial tuberosity just below the knee joint. This is the muscle that is inherently weak when people have hyperextended knees. This is a lateral view of the right knee. I wanted to show this because it shows the patella and the patella tendon being suspended in space there. And also behind that patella, you can see the bursa sac, that blue thing. If you're in knee hyperextension, it smashes the patella down onto that bursa sac and can cause a lot of pain and trouble. This is a photograph of a ballet student in a first position, both photographs. The photograph on the left shows severe knee hyperextension, left knee greater than right. And you can see how the knees are together and the heels are way far apart. This is severe knee hyperextension. I would say the left knee is maybe in 7 or 8 degrees of hyperextension, the right knee maybe 4 or 5. So this person would really need to work on quadriceps strengthening and also modify their ballet technique. The photo on the right shows a modified first position of that same person. So you can see that this can be controlled through the person actively correcting for the knee hyperextension, and it will feel like the knees are bent to this person, but that is actually a healthy straight position in order to work for better technique. So now we're going to measure knee extension without a goniometer. There's the joint line that I just pointed to, and I'm going to have her bend her knee up, and that's where the goniometric arms would go, and that's the angle I would measure for knee flexion. Now I'm going to have her straighten her knee out, and you'll see the red line is going to be flat and straight. That is 0 degrees knee extension, normal range. Now she's going to extend all the way, and you can see that line is no longer straight. That dotted line comes in at an angle, but it's very slight. That's only 1 or 2 degrees of knee hyperextension. She's going beyond 0 degrees. This is a classic photo that was used for a very long time in watch ads. This is an example of maybe 2 to 3 degrees of knee hyperextension and a very high instep. So 2 to 3 degrees gives that beautiful line that really adds something to the ballet line. However, it is not absolutely necessary to have in order to be an esteemed dancer. This photograph is of a principal dancer in a lovely arabesque. You can see her standing leg perfectly straight, the leg in arabesque perfectly straight. That is 0, maybe 1 degree of hyperextension, but that is a very secure knee, and that is a knee that's going to be less prone to injury. Here is an example of another straight knee, maybe 1 or 2 degrees of hyperextension in her standing leg, but not much at all. This is a very stable position for the standing knee. This photograph of the swan that is in the front in susu position has 2 beautiful straight knees. That is not in hyperextension, and this is a very stable position for her. This is an example of knee hyperextension on the standing leg. It looks like this is the end of a renversé. So the arc of the back leg going around her in attitude will push her standing knee a little bit farther into hyperextension. But the hyperextension is quite minimal, meaning that the knee is secure. The knee up in the air, you could see the angle of the lower leg goes at a diagonal compared to the thigh. That is maybe 2 or 3 degrees of knee hyperextension. So this is, again, within safe range. The fact that she has a very high instep makes it appear that there's more hyperextension there, but really it's the arc of the ankle. This was an interesting photograph in that you could see both the man and the woman standing, and you can see that the man has more hyperextension than the woman does here. That's bordering on maybe 5 or 6 degrees of knee hyperextension, which is particularly worrisome in that he probably has a lot of big jumps to do. And that could possibly make for an unstable landing. So I would highly recommend cross-training for this individual to be sure that those leg muscles are strong. In this photograph of a beautiful split, you may think at first glance that there is hyperextension here, but really it's the arc of the foot. This dancer has very high, beautiful insteps, but those knees are straight and solid. Her shoulders, on the other hand, are in hyperextension. So this is someone that is extremely flexible, and that you can see that her shoulders are extending behind her. This is an interesting photograph in that it's a corps de ballet, so you can see all kinds of standing knees in different positions. Going left to right, the girl in the short blue skirt has excessive knee hyperextension. That would be about 4 or 5 degrees. She needs to do some cross-training for that to strengthen her quads. The girl in front of her with the red leotard has slight knee hyperextension, and there are some others with knee hyperextension in the group. Can you find them?